the future for Keith and thousands like him lies in the hands of research teams like this, based at the University Hospital of Wales in Cardiff. This team is one of many working with patients across Wales and the UK. It's not just about finding a cure. For them, cancer care has to get smarter.
We need to move medical research in cancer forward. We need to look at new drugs such as chemotherapy, radiotherapy and surgery to try and treat those patients with cancer, but also prevent the cancer occurring in the first place.
A lot of cancer survival is about actually identifying that something's not right at an early stage, and whilst we sometimes do that through screening programs, often actually it's about us as individuals recognising that something's changed and something's different from our point of view for us from what's normal. So there's a lump that we don't recognise, or there's a mole that's got larger, and going along to see our GPs.
What we're thinking about is things like when an individual has a symptom and they go to their GP, say a cough or bleeding, and what's the next step of investigation on whether that's a cold or some sort of condition, or actually the first signs of cancer. So can we send them for extra x-rays, for example, to see whether or not they have any cancer within them, or extra screening, for example.
Wales is respected for its groundbreaking research. At the moment, Cancer Research UK and the Velindre Cancer Centre in Cardiff are leading the biggest lung cancer trial in the world. But in these tough economic times, can all of these voices be heard? At this meeting, guests were told that the Assembly had to do the best it could with the resources available.
We all are aware of the economic climate. We all know how hard it is to manage within our budgets. But we're learning, and bit by bit, we all learn to manage our budgets, taking out a few luxuries here or wherever. I think this is what's got to happen for the Welsh Assembly Government. They too need to review what's going on at the moment. They've got to look at the future needs of our patients and our population, and then set those priorities within the restrictions they also have on their money.
One area of care that often gets overlooked is mental health, yet it affects 1 in 6 of us here in Wales every year. I'm here to meet a woman who is that 1 in 6. Sharon Harris lives with severe depression and obsessive compulsive disorder, or OCD.
Back in 2002, I suffered severe depression, and my OCD kicked in majorly then, and it completely took over my life. By the 2003, I couldn't leave the house. I was so concerned about everything being in its place. Everything had to be right. If it wasn't right, in my thoughts, things would happen to my family, my friends, and it would be my fault these were happening.
One of the things that we recognise is that very often mental health is neglected. We tend to think about physical health and we don't actually recognise the importance of mental health, but actually a high proportion of the population will at some time in their lives experience some kind of mental health problem. And we also know that poor mental health, or mental well-being might be a better way to talk about it, actually has an impact on so many other things.
So Shaz, even making a cup of tea can cause problems. Talk me through some of those.
Yeah, it can, because I'll just pop this on. If I have a problem with like switches, lids and things, so if I switch that on and it didn't feel right, I'd have to knock it off and switch it back on. Milk, if I open this milk now, I'll just pour some. I have a problem with lids, so if at first I put this lid on and it didn't feel right as I was putting it on, I would have to take it back off. And then I could do this up to 10 times until, to me, it feels right. And also with bottles, the air that is in the bottle, it's got to be just right. If there's too much air out, I feel that I'm squeezing somebody's air out of their lungs. I know it's not a truth, but that's part of my thought process to do with the OCD. And so until I get that enough the air in there, that won't feel right to me.
Sharon began to manage her condition with the help of the mental health charity Haval. What do you think would have happened to you without this project?
I still would have been in the house in the same situation, deteriorating more and more. I wouldn't have gone out. I had to be pushed to come here, but as I said, it was a life-changing for me. It had completely changed my life. This service is an ongoing service. As long as you need it, and you know, it's there. And if they take that away, where will we be again? We'll be, as I said, locked back in the house.
Now Sharon is a volunteer for Haval and studying for a degree. She works 1 day a week.
We know that being in work is generally good for our mental well-being. For example, being unemployed is generally, quite poor for both mental and physical health. So a lot of the programmes that we work on are about trying to help people to remain in work and to help employers look at what they can do to improve the health of their workforce.
Sharon's friend Suzanne has seen her struggle to overcome her condition.
If you dusted or moved things in Sharon's house previous, if I was to dust something and put it back and it wasn't in the right place, she'd go behind me and she'd move it. And I'd say, for God's sake, I put it back where it was. No. This is where it's supposed to be. And she'd go behind you, see?
And just a tiny amount.
Yeah. Unbelievable. I just think she's nuts.
Only a friend could say that.
Yeah, exactly. And then the incident when we walked into Aldi's, it was the day just after she told me about what was happening, and I thought, oh, this isn't real. I've never heard of this. We went to Aldi's because Aldi's was based right opposite Sharon's old house, and we went there. We walked in through the doors. I walked in. I turned to look for her, and I thought, where the hell has she gone? I looked behind me. She'd only walked back out of Aldi's, and she had to come in through the other door. And I said, what are you doing? No. As if to say, don't say no more.
Yeah. And that was a regular type of thing that you do?
Yeah.
Is it nice to see the change in her now? Then?
Oh, yeah, definitely.
I can't spoil my makeup.
Haval is also lobbying politicians before the election with its campaign camper van touring the country. A key demand will be the protection of funding for mental health services.
Although funding isn't everything, it's extremely important, and people with a mental illness in Wales, whom we represent, recognise that there isn't going to be a huge amount of new funding, but if you're going to do anything to improve matters, then you've got to preserve the funding that's there. The other really important thing we must have is a commitment from candidates of all parties that they'll listen to what mental health service users want and then act on that, actually deliver care plans based on their choices of what services that they need. There are votes in mental health. If you've got a good message, a real concrete message for people with a mental illness, they'll listen. They're quite likely to vote for you as well if you've got something positive to say.
Tonight we've met people for whom the National Health Service is critically important. Of course, in reality, it's important for all of us. Just how much is demonstrated by the response to our Wales 1000 poll, which asked, should prescriptions in Wales remain free? The result is clear. Of those who took part, 81% said yes, prescriptions should remain free. Only 16% disagreed. Aneirin Bevan knew all about the pressures of bringing up a healthy family. He had 9 brothers and sisters. His legacy, the NHS, has changed the lives of millions. Today, as we grow older, fatter and live longer, will the next Assembly government ensure that the NHS in Wales can cope?